Good afternoon, everybody. I would like to introduce Terry and Maria from Senior Medicare Patrol. They have some points to make about fraud and things you should be aware of. So if you can give her your undivided attention, thank you.
Thank you, everybody. Thank you for having us in. I'm Terry Drew. I work for Elder Services of the Merrimack Valley, which is in Lawrence. And even though Merrimack Valley is our service area, this program, the SMP program, is actually a statewide program. So I'm all over the state with this information. SMP is a federal program. It's a grant-funded program through the Administration on Aging. So this program comes directly from Uncle Sam, the federal government, through the Administration on Aging for Medicare beneficiaries. It's an education and awareness program, and what we do is we bring out information to the community on how to protect yourself against healthcare errors, fraud, and abuse. And if you are having concerns, we help you address those concerns on an individual basis. So if you do want to speak to me before I leave today, just let me know and we can have a private chat, okay? But for the most part, this is education and awareness. And again, if somebody does have something going on or some concern, we'll look into things and see where to go from there, okay? SMP actually stands for Senior Medicare Patrol. And since this is a federal program, Uncle Sam likes to put brands on things, sort of like CIA and FBI. You kind of know what that is right away. Where our brand is the SMP logo. So again, we're SMP, but that stands for Senior Medicare Patrol. And I like to sort of put a visual out there. It's really people using Medicare or on Medicare, kind of keeping an eye on their Medicare. You want to patrol your own Medicare. Just keep an eye on the papers that are coming in. Keep an eye on the billing that's coming in. Any phone calls you're getting, anybody knocking at your door. You sort of want to just kind of question things because there's a lot going on out there that you really want to be aware of. I gave you a lot of information there. A lot of the information is for you to take home and read. Some of them are news articles, some of them are fact sheets. I will be pointing out various things as we go along, so if you have any questions, just let me know as well. Can everybody hear me okay before I go any further? Okay. Inside the bag, there's actually a healthcare journal. So if you have a minute, you can look inside the bag. And a healthcare journal is really a tool that the Administration on Aging has recommended people use when they're out in the healthcare system. So this really means when you go to the doctor's appointments, maybe when you go to the dentist, or you go get your eyes checked, or go for an x-ray, or whatever it is that's going on in your healthcare, you want to keep track of that. You want to write things down, you want to write the dates that you're having things done. If you have questions for your providers, you want to write those down and make sure you're getting those answers, okay? So the journal itself will help you with that information. I'm just going to put one on here real quick. So the journal looks like this. There's a little bit of stuff inside. And it opens up nicely, so there's a lot of good spaces to track all your information. A lot of people already use a journal if they use a notebook or a calendar. It's basically the same thing as long as you're keeping track and making sure that you're getting your questions answered. One good thing about keeping a journal or a notebook is when you do get your bills, it's easy to go back and cross-check the dates that you have something written down against those papers that are coming in the mail. And especially if you're on Medicare A and B, you're only going to get your Medicare summary notices every 3 months. So that's a lot of information to look at every 3 months, especially if you had a lot of services. So really this is about awareness. You want to just make sure those papers are yours, nobody else's, make sure there's nothing extra on there. And if you do have a question on them, make sure you're getting those questions answered. And we have various numbers of ways to get your questions answered, okay? Because Medicare is very confusing. It's not easy to navigate, but there's a lot of good services out there for free that help people get their questions answered. And when I say free, that's also, you want a buzzword. You want to, if somebody's offering you something for free, you really want to question that. What do you mean it's free? Because usually nothing's ever really free, right? When I say free, this is a free program, meaning we're not asking you for anything, but it's not free in the terms that this is federal dollars. This is our tax money basically working hard. So again, you want to question if somebody's giving you something for free, that's just kind of a little red flag that you want to kind of question, okay? But the Healthcare Journal is a great tool to use if you find it useful for yourself. There's also a pamphlet in there, and basically the take-home message from the pamphlet is to protect your information, your Medicare number, Social Security number, date of birth, all that, your banking information. You want to detect any irregularities, as I was saying, on any of the paperwork coming in, any of the care that you're getting. So if something doesn't feel right, you want to question that. And you have a right to have an answer. If you have a question, you have a right to have an answer, okay? And then it says to report, and that doesn't necessarily mean writing out a legal report or a police report, or it could be, depending on the situation. But really, reporting things is just kind of raising that flag in your own life, like, what is that? What's going on? I need to call my doctor to ask them what the heck that means on my paper, or I'm going to call the insurance company, or I'm going to call Medicare. I'm going to call somebody because I need that question answered. So really, that's what it means by reporting. Just kind of question and make sure you're getting your proper answer. And what we do normally is if you have a question on some kind of billing or healthcare concern and you're not getting a legitimate answer, or it's just taking you too long to get through to somebody, what we can do is sort of help break through some of those barriers to help people get some of those answers. Okay, it's very difficult out there navigating the telecommunication system. You call somebody, you're on hold forever, you're pressing a million buttons, that kind of thing. So it can be very frustrating. So that's what we're here basically to help people make sure they get their answers. And again, if you are having concerns around anything on your bills, anything going on in your health care, we'd like to know, because we want to make sure that you're getting the quality health care that you deserve, as well as the correct billing, okay? Our contact information is on the back. It's on the back of the journal. There's a pen in the journal for the journal. Our phone number's on there. There's an eye magnifier, like a little handy-dandy eye magnifier, ruler, bookmark, 3-in-1 thing. Our phone number's on here. So we try to put our number everywhere. It's on the bag as well, okay, and the website. So we have a nice little website here in Massachusetts, okay. Also in the bag, there's a lot of papers. There's also a paper in there that addresses healthcare errors. And those are really things that should never happen to you in the healthcare system, okay? Basically, Medicare is saying that they don't want the bill for something that never should have happened, and neither should the beneficiary get the bill either. So this is really about accountability on the provider's side, on the institution side, on the hospital side, just to make things a little bit more safer out there for people. And again, if you're involved in something that has something to do with the quality of the care that you're getting, we'd like to know, because we have a lot of partners here in the state that we work with very closely to make sure Medicare beneficiaries are safe. We're partnered at the state level with the Executive Office of Elder Affairs, which is where the SHINE program comes through. Are you guys familiar with SHINE? The Serving Health Information Needs of Elders. It's the free, I say free because it's our tax dollars, free Medicare counseling for Medicare beneficiaries or soon-to-be Medicare beneficiaries around all the health care or Medicare questions. There should be a pamphlet in there for the SHINE program. Normally, every council on aging or senior center has a SHINE counselor, usually. It's volunteer driven, so if there isn't one in your community, there's an 800 number you can call, and they'll basically tell you where your closest SHINE person is. Normally, you can go to the next town over if it's locally. If there's a SHINE person next town over, you can go there. You just have to call for an appointment. But just to let you know, it's a free service. If you have any questions on Medicare, especially now it's open enrollment, just started on the 15th and runs to December 7th. So if you have any questions on Medicare, Medicare A and B, Medigap plans, Medicare Advantage plans, Part D plans, what if I'm railroad retirement benefits, what if I'm a retired teacher, what if I'm a retired municipal, those all have various different insurance parameters. Any questions at all, the SHINE counselors are trained to navigate Medicare and to give you straight answers to your questions, okay? They are also trained to look at some of the papers that we're going to talk about, but if there's a concern, again, basically around billing that Medicare, SHINE isn't comfortable pursuing for you, then they should actually let us know, or you should let us know, and we'll help you do that as well, okay? So SHINE and SMP, just, we try to work in partnership as much as possible, as well as in many other organizations. We also partnered with MassPro, which is Massachusetts Peer Review Organization. It's a lot of terminology, and I'll point out various things in the bag, which has this information. MassPro basically is a contracted organization with Medicare. Every state has one that Medicare partners with to review quality of care concerns. So if you have something going on in your health care that you want addressed, MassPro are the people that you want to know. And they're doctors and nurses that actually work at that organization. It's not business people, they're not legal people, they're not law enforcement. They're professional healthcare providers that want to know what's going on out there with your health care and make sure that you're safe, okay? We're also partnered with Medicare Advocacy Project, which is through Senior Legal Services here in Massachusetts. And again, these are all free programs. Medicare Advocacy Project is a free legal advocate program for elders on Medicare. Okay, so if you have concerns around Medicare, there's a free service for you to help basically get some answers if you have a legal situation going on with Medicare. Could be appeals, it could be anything legally around Medicare. But Medicare Advocacy is there, and I do have information that I have in here for you, okay? I know that I gave you a lot of papers, and I know that you're having lunch, so it's a little difficult to actually go through the papers. So when you get home, if you have any questions at all, you can call me directly through the 800 number, and you can ask for the SMP program. But if you dial the 800 number there to Elder Services and you ask for anybody in the SMP program, they'll probably patch you through to either Pat, who's the program assistant, or Lucilia Prates, who's our director. So, but anyone in the office, and we also have a volunteer coordinator, Caroline. So anybody in the office can help you with any question that you may have. Before we wrap things up, I do want to point out, in the bag, there's a sample Medicare summary notice. This is just a sample in case you had any questions on that. Okay. There's a yellow sheet that kind of looks like marigold. It says gaining access health services for Massachusetts seniors. This yellow one, I'm going to ask that you actually recycle, or if you can give that back to me, and I'll recycle, because I've actually replaced this with an updated form. This is still good, but it's updated a little bit. Some of the numbers I've updated, okay? There's another sheet in there. This is like a canary yellow, I guess. This is a fact sheet. This is not a news article. This is about those healthcare errors that Medicare is addressing. Okay, so basically to get people more safe in the healthcare community, to get hospitals to be more accountable for what's going on behind the scenes. I like to say, too, this is never a blaming game. We're never out there blaming anybody for anything. We never assume something's fraud right away. If people do have concerns, we look at things as this is a simple error. Whatever it is, we get it cleared up, you know, it's all done, we move on. Normally, if we can't get something cleared up, or if you can't get something cleared up in a couple of phone calls, then we kind of push it a little bit to see why not? Why can't we get a straight answer? Why is this so difficult for you to get an answer? Or what is this situation? We kind of dig a little bit more, and ultimately, when it comes to investigations, which we really don't do because this is a community education program, we actually turn our investigations over to Medicare. Okay, the CMS contractors here in this state. And what they do is they actually do launch investigations if you do have concerns around anything going on in your health care. They have the right to go into the medical records and actually look at to see what's going on. So where we basically just do community intervention, we do education, awareness, and if you do have concerns, then we sort of, you know, we go down that road if we need to. Okay, does that make sense? Is this helpful? Okay. Again, it's a lot of information, so if you have any questions, call me directly. I gave you another little bundle, lots of papers, and we're trying to cut back on papers, but I think a lot of this is important to have. Everything that I'm saying is on this one little, it says Massachusetts SMP Senior Medicare Patrol, and it has little bullet points. Basically, everything I'm saying is on this little bulleted sheet, okay? Wherever in every state, including our territories. We also, for the written healthcare journals, we have languages. We have Portuguese, Spanish, Chinese, Vietnamese, Korean, and Russian. So there's 6 languages besides English that we have the written material for. But my director, Lucilia, has partnered with up to 22 languages here in the state. So if anybody has any language needs, again, let us know, and we'll also work with getting people help with that. And that includes Shine. We're also partnered with a lot of language Shine programs, okay? So just keep that in mind. There's a blue paper in there. This is the senior legal services I was talking about. And out of Senior Legal Services is Medicare Advocacy, and I'll show you where that information is. There are a couple of news articles in there, new tools to strengthen Medicare. There's another one about SMP and seniors fighting fraud. And then there's another one, I'm drawing a blank, I'm sorry. Hang on. The most important one, right? I have to look at somebody's. Basically, this is everything that I'm talking about. We have SMP right here in the front. Then we have Shine, next one down. We have information on Medicare. Healthcare for All is another great organization here in Massachusetts that helps people out with insurance concerns or healthcare concerns. Medicare Advocacy Project, that's the one through the Senior Legal Services for free legal assistance. Massachusetts Peer Review Organization, this is the quality of care people. On the back, again, this is just contact information, like a quick reference sheet. Executive Office of Elder Affairs, if you want to get in touch with them. The Attorney General's Office, we're partnered with them as well. So again, you can call directly if you have concerns. Department of Public Health is on here. Social Security Administration, Mass Health. And down here at the bottom, medications assistance. This is very important if you need any help with medication coverage. I would say take this information to your Shine counselor, and they will know exactly everything on here. So if you need help with medications, take this to your Shine person. Say, please help me. These are great programs above and beyond any plan that you may have purchased or bought into or whatever. These are not plans, these are programs, assistance programs above and beyond, and they're really great. There's some here in Massachusetts, there's some federal programs, so I would definitely recommend people, if you need assistance with medication, these are great programs to tap into here in Massachusetts, okay? So I want to say, in a nutshell, as they say, that's the SMP program. I gave you a lot of information. Don't feel you need to take it. You know, I don't want to force anything on anybody. But if you want extra, just let me know, and I can actually mail stuff because you know, there's a lot of people here, so I hope I have enough for everybody. For
508-999-6200.
Okay. So does. Well, there you go. So Coastline Elderly Services, which I've done presentations there actually for the money management program. I've done a presentation there for the money management program, and I know that Lucilia's been there as well. So that's a great resource as well. So any concerns you're having, there's lots of help out there, so don't feel you're out there all by yourself. And if you know of anybody that could use this information, we do have a couple extra, and again, I can mail anything that you need. We can always come back and do another presentation at another time if you feel that you'd want us to come back. Okay. Does anybody have any questions before we wrap up?
I do.
Yes.
I got a Medicare statement talking about charges for one mammogram I had, and there were 2 sets of charges for each. There were 4, right? 4 charges for a mammogram. And so I went to my calendar and said, okay, I had 1 mammogram. And I decided, well, I think I should call Medicare because it looks like there's 4 billings for one thing. Some of them seemed like they were doctor charges in addition to the procedure charge. So I called Medicare, and the person told me that I had to call the provider of the service. Now, is that something that your SMP might have helped you with?
Absolutely.
I did call the provider. Of course, they've got a canned response for what it was. You know, like, oh, you had to have, within the 1 mammogram, you had to have 2 mammograms. You know, so they had a response ready for it. But it seemed to me that I would bill 4 times for 1 procedure. Okay. And I didn't feel that Medicare was really offering much solution. I was kind of like informing them that there was some irregularity there, and then they sent me to the
And sometimes it depends on who you get on the other end. Some people are really good. Some people will say, call your provider. Some people will tell you to call SMP, which is good. But that's a great example of somebody looking at their Medicare summary noticing and noticing something that just wasn't right. And since this is an awareness program, we're encouraging people to pick up that phone and make a phone call. But if you're not getting a clear answer, this is absolutely something we can help look into. Ultimately, what we would do with this situation is we would go ahead and make those phone calls on your behalf as well to see what kind of response we get. We would say, can you explain that a little bit more? We're really not clear. And ultimately, if we're still not clear and we can't get a straight answer, we would turn that right over to the investigators. And they would dig down, go right into your medical records and actually look. Now, some things on Medicare summary notices are perfectly valid. For instance, if you had a radiologist read your mammogram, you're going to get a fee for that, but you didn't see the radiologist. You know what I mean? So that may have been part of that. So, but right, and that's okay, and that's perfectly good to question, absolutely. And that's the whole point of this program, is to look at things and say, what is that? Let me get that answer. Have a great afternoon. Thank you.
And let's thank Teresa for a nice presentation.
I want to thank Maria, actually, SMP volunteer. Thank you very much. We're always recruiting for volunteers, so if anybody would like to help us out and kind of do what we're doing.